There are efforts underway around the Upper Peninsula to help healthcare workers during this pandemic. Local 3's Rebecca Bartolome has more.
Healthcare professionals, they are on the front lines of the COVID-19 pandemic. They need supplies such as masks and gloves to do their job, but supply is limited. In the UP, UPers are coming together to help with some of that burden.
The name is Masks for Marquette, and it just started because I saw other nurses around the country that were making masks out of paper and office supplies and craft supplies because they were out of masks or running out of masks in places that the infection has already, begun to spread more than it has here. And I don't want our healthcare workers to be in that position.
The effort started late last week with the Mask for Marquette Facebook page. With about 1,000 members, there are about 100 sewers, and a GoFundMe page is also set up to help people in that way.
We're in need of elastic, which we can get, and it's still available. And then we have businesses in Marquette that are making us the aluminum nose pieces.
Sally has been in contact with both UP Health System Marquette and Bell to see if this is something they could benefit from.
A lot of people are concerned that we're putting people at risk or that they don't know the dangers of using what we're making. But the infection control people are going to instruct them how to use them properly so that they're safe. And like I said, they'll either be using it over an existing mask to prolong the life of that mask, or they will be using it with a filter. So while it is not to replicate the actual medical masks, I guess what people are saying is it's better than nothing.
Sally says the biggest need right now is sewers. There are 4 drop-off locations for the masks: Econo Foods in Marquette, Ace Hardware in Harvey, Ace Hardware in Ishpeming, and Sally's Residence in Gwinn. Another effort is underway creating face shields using 3D printers.
As someone who runs a 3D printing lab, I run 5 printers, and because you get tied in a network. So a couple days ago, we started getting emails for these causes, like, can you fire up your printers and send to national databases or places where they're collecting them. And so I saw some of those emails. My printers weren't at home, they were at school, and I thought, oh, this is cool that people are trying to help. I wanted to know what was local. So I just started asking around and realized that we do have a need for this locally. A few of us makers just started kind of like talking online and saying, let's try some of these models. So we started printing some, I think Saturday. There were a couple different decent ones out there that they were using. And then when I finally connected with local people, the model that they wanted was one of the ones that we were working on.
Becky says production is a slow process, but with efforts also from printers at NMU and Escanaba and people who use them at home as a hobby, they'll make as many as they can.
I get about maybe 3 of them made every hour and 40 minutes. If you have 0 and you have nowhere to buy them, I think they'll take 3. Talk to a few nurses that would take anything I got right now.
Becky says they are also looking at more productive ways to create these. If you don't have a 3D printer, she says she also needs plastic sheeting and elastic to make them. For more information on both efforts, visit our website, upmatters.com. Reporting for Local 3 News, I'm Rebecca Bartolome.